Hey everybody, welcome to Pick Dr. Osborne's Brain. Got a lot of questions that we're going to dive into today. If you've got questions, make sure you go ahead and start typing those in. I'll do my best to answer as many as I can in the hour. And today's topic is all about anxiety. So if you've got questions about anxiety, natural solutions for anxiety, things that you can do to improve your anxiousness, improve your sleep, improve your ability to feel calm, well rested and relaxed, those are the questions that we're going to focus on today. So again, welcome to the show. Let's dive in. So some of these questions were actually from our full show on anxiety. And if you missed that show, the replay is available. As a matter of fact, we'll go ahead and put that up, that link up in the feed for you here. And you can go back and watch it. There's a lot of great information there, and don't want you to miss out on that. But let's start with some of those questions. So Mealy is asking, how to help with a child who has OCD hand washing as a problem, meaning they're running to, I would assume you mean they're running to wash their hands on a aggressive basis. I think the best thing that you can do with a child that has OCD is understand that most people with any form or framework or mindset with an OCD, the idea came from somewhere. So like hand washing, where did that idea come from? Maybe it was a mom or an aunt or an uncle or a teacher or somebody who said, hey, wash your hands more frequently. And where have we heard that message in the last 2 years, right? Don't watch your weight, don't eat well, don't go outside and get exercise, but gosh darn it, make sure you rub chemical cocktails in the name of clean hands all over your hands every 10 seconds or every time you get up from your chair. That has created a ton of OCD for kids in the hand washing realm. And I think where you start with that is educating them, right? Teaching them why it's not critically important to wash your hands every 10 minutes, and that you have on your skin, you have natural oils that act as antibiotics, that act as probiotics, that act as protection to your immune system. And if you scrub that away, because you're worried about germs to such a degree, you're actually going to increase your risk of developing skin infection and increase your risk of developing skin inflammation. So I think the best place to start with somebody who has an OCD mindset is educate them so that they can let that go, right? Because a lot of people who have that anxious thought or fear over something, if you educate them in the opposite direction, you really can make a change in their behavior. Let's see. I've been taking a lot of melatonin, and I'm kind of worried what it might do to me long term. So I think it's important to understand that using melatonin every day for sleep isn't the greatest idea in the world. It doesn't mean you can't use it. It doesn't mean it can't be beneficial or helpful for sleep. But I think the bigger question to ask is, why are you needing melatonin to get to the level of being able to go to sleep? And I think for a lot of people, one of the biggest answers is lack of outside sunshine. A big part of how we regulate melatonin is through UV exposure to sunlight. And so most people don't get anywhere near enough. What's enough? Hours a day is ideal. Not 10 minutes or 15 minutes or 20 minutes, but hours a day of sunlight or direct sun exposure is ideal. And I say direct, you could be in the shade, but be outside and still get that exposure. And that's going to help your body produce its own melatonin. But the other reason why people run out of melatonin, they burn through their melatonin. Remember, melatonin is an anti-inflammatory, and it's an antiviral and antibacterial, and melatonin is also an antioxidant. So if you eat poorly, have bad habits, you're going to use up more of your melatonin to try to accommodate for those bad habits, and you're not going to have enough at night in order to put you to sleep. So take those things in mind. And if you have to use it here or there every once in a while, like when you travel and you're changing time zones and you're trying to keep your sleep regulated, don't worry about that. But the other thing you can do, if you want to do something from a green medicine perspective where you want to take something else beyond melatonin, because the longer you take melatonin, the more you reduce your body's ability to produce it, is you could use something like GABA or theanine. And these aren't habit forming, they don't create deficits in you, and you can take them over the long haul. I actually have a formula. We can put that up on the board too, but we have a couple different formulas with GABA and theanine in them, and one of them is called Sleep Well, and that might be something right up your alley if you're wanting to get away from the use of heavy melatonin. Let's see here. How to stop sleep anxiety. I want to exercise, but I notice I sleep very poorly after a day exercising. You're probably going too aggressive, Gene. If you've got sleep anxiety at night, I would say still exercise, but do less of it. Scale it back, because what's probably happening is the exercise is too aggressive for your current stress load, and so it's pushing up your cortisol and adrenaline to exercise, and then that gives you a problem at night when you're trying to go to sleep. So just back off of the exercise, do less than what you're currently doing, and see if that doesn't help. Let's see here. We got that one covered. Okay, let's go to the direct feed now. Christina wanted to know, can acid reflux cause anxiety? Yeah, it can cause anxiety because your esophagus, your stomach share the same nerve innervation as your heart, and you can actually get a reflex between the tissues that if the nerves are irritated because of the reflux, you can actually overstimulate the nerves to the heart, increasing heart rate, which can subsequently affect adrenaline and drive anxiety. So then there's also the psychological component of any illness, not just acid reflux. But when a person has a problem and they don't know why, the lack of understanding as to what they can do to fix that problem can drive their anxiety up as well. So there's that to consider. Does niacin deficiency cause anxiety? It can. It absolutely can. So, if you are getting your nutritional levels tested and you're coming back and you're low in B3, it definitely can cause it. Niacin, in my experience, more than anxiety, though, causes forgetfulness, mood swings, irritability, and brain fog. But it can cause anxiety as well. Usually, from a B vitamin perspective, B1 deficiency has more of a tendency to drive anxiety. Can a thyroid test tell a lot about what's going on with the body, and can thyroid malfunction cause anxiety? It absolutely can, specifically too much thyroid. So if you have Graves' disease, for example, which is an autoimmune disease where you're producing antibodies that mimic thyroid hormone, that can definitely drive up anxiety, cause heart palpitations, trouble sleeping, restless legs, make it super problematic for a person. So, but the thyroid test as a whole, it can tell some things about your thyroid, but it also depends on the depth of the thyroid testing that your doctor does. Most doctors today, they'll run a TSH, which is not all that valuable by itself. It's a good piece of information, but by itself, TSH is a hormone that's not even made by your thyroid gland. It's a hormone made by your pituitary gland. And so you wouldn't want to base a person's thyroid health on a TSH test alone. So TSH, T3, T4, reverse T3, iodine is very important, vitamin B2, vitamin C, zinc, magnesium. These are all nutrients that your thyroid needs to properly function. And so those are all important to measure to assess a thyroid. If you go back, I did a crash course on thyroid. Maybe we can throw that link up too. That might be helpful for you to kind of go back and watch that crash course if you want to learn a little bit more about thyroid specifically. Let's see. My grandmother has type 2 diabetes and dementia. She takes sertraline, which is an SSRI, memantine, and aspirin. Well, she's on a whole lot of stuff. She takes a cocktail of neurological drugs times 8 years. What vitamins and minerals could she be depleted of? She's 91. With that laundry list, the first thing that comes to mind is vitamin C, vitamin D, iron, folate, zinc, magnesium. So that's where I would start. But at 91, if she's open to testing, she's obviously open to medical intervention because she's taking that entire cocktail of, in my opinion, is overblown. That being said, if she's open to testing, have her doctor, ask her doctor to run her nutrition testing, intracellular nutrition testing, and you can get a much more accurate and specific read on what exactly she may need that could be helpful. How can I know if I have leaky gut? Well, there's kind of two ways to think about that question, Emma. One is objective testing, and there are a lot of different types of tests. There's not like a definitive test that says if you're positive in this test, you have a leaky gut, but there are lots of tests that give us clues and insights as to whether or not your gut is leaking. So there's zonulin is a type of test. There's a sugar alcohol test that can be measured by docs that will tell you whether or not your gut could potentially be leaking. There's measuring something called LPS antibodies. LPS stands for lipopolysaccharide. And measuring antibodies to lipopolysaccharides is oftentimes a clue that a person has a leaky gut. If you're eating gluten and you're gluten sensitive, you have a leaky gut. If you are struggling with autoimmune disease of any kind, whether it be Hashimoto'S, rheumatoid arthritis, lupus, scleroderma, dermatomyositis, ankylosing spondylitis, multiple sclerosis, Lou Gehrig's disease, Guillain-Barré syndrome, autoimmune hepatitis, so any of the battery of what we know to be autoimmune diseases, there's about 100 of them, you probably have a leaky gut. And so I would say the least important question to ask is whether you have a leaky gut. The more important question to ask is, if you assume you have a leaky gut, what are the potential possibilities of what's triggering that? If you know the triggers, then it doesn't matter the name that we choose to call what the triggers are creating. You can change the triggers. So for example, what are the 4 triggers? What are the hallmark triggers? These are the things that I like to measure when people come to see me. It's food is a trigger, eating the wrong food. Chemical exposures, the wrong chemicals can be triggers. Microbial imbalance can be a trigger. For example, yeast overgrowth in the intestine is an example of a microbial imbalance. And then the 4th triggers, or set of triggers, are nutritional deficits. So those are the things really that, in my opinion, are more important to measure than trying to measure leaky gut directly. Because again, leaky gut can be caused by those 4 categorical triggers, and oftentimes it's more than one that's contributing to it. Very rarely is there just a smoking gun for why leaky gut is there. Is taking iodine supplement good for Hashimoto's? Yeah, it can be if you're iodine deficient. There's a lot of information out there that says don't take iodine if you have autoimmune Hashimoto's. I disagree. And I see in my practice, I put people on iodine all the time. And many of these people have Hashimoto's. So it's not iodine that's bad for autoimmune disease. It's whether or not the person has an iodine deficiency. So it's more important if you have autoimmune thyroid disease that you have your iodine levels properly assessed to make that determination to a degree of accuracy so that you know you're going to do your body some good. Let's see. I have a friend who's a carrier of sickle cell. Is this autoimmune, and does grain gluten consumption affect this? No, I mean, sickle cell anemia is a genetic trait. So it's a genetic trait that actually, we believe, evolved out of the need for protection from malaria. So sickle traits are where you have a genetic code that when your red blood cells are formed, they form, instead of forming like a nice bilateral concave disc, they form like a sickle shape. And that sickle shape is more resistant to malarial infection. So it helps to prevent malaria. So in certain regions of the world where malaria is epidemic, we can actually, the sickle trait is protective and beneficial. Problem with it though is if you have it, that you don't carry oxygen as efficiently, and so you can become anemic in that way. And so the best way, if you've got a sickle trait, for one, no, it's not an autoimmune condition. You're not going to change it or exacerbate it through the same mechanisms of autoimmunity. But what you can do is support your red blood cells. And one of the best ways to support healthy, strong, robust red blood cells is through B vitamins, B12, folate, and other B vitamins are super important for the proper formation. Vitamin E is very important for the membrane integrity of red blood cells. So vitamin E deficiency can cause your red blood cells to break easily or prematurely. So making sure you're getting adequate nutrients can support your red blood cell function should you have sickle cell trait or characteristics. My aunt has autoimmune vasculitis, renal insufficiency. She's on hemodialysis and kidney tumor. They won't let her eat anything with sodium or fat due to fatty liver. I mean, that's ridiculous. Fatty liver is not caused by eating fat. Fatty liver typically is either caused by eating gluten or it's caused by eating excessive carbs, but fat does not cause fatty liver as a general rule of thumb. And she also has stones. I would assume you mean kidney stones. How do you help her? She's got to be, Sandy, she's got to be open and willing to make changes. She has to be willing to help herself. And by helping herself, that means she's got to be willing to look at the advice that she's been being given and possibly not follow some of it, because some of it, according to what I'm reading, isn't great advice nutritionally. Remember, the average medical doc gets about 7 hours of nutritional training in their entire medical curriculum, and most of that nutrition training that they do get is anti-nutrition training, meaning, hey, nutrition doesn't work, so don't even worry about suggesting it to your patients. But I would say she's got to be willing to help herself by seeking out additional assistance. So if she wants help, she's really got to look for in my opinion, have her look for somebody who's a functional practitioner who has a very strong background in nutrition, because, vasculitis is, an autoimmune condition. Renal insufficiency could be autoimmune. Autoimmunity has 4 triggers, 4 families of triggers, which I just mentioned earlier: food, chemicals, nutritional deficiency, and microbial imbalance. And unless somebody's measuring those things, it doesn't matter how many drugs or how many medical procedures or other interventions that you do with her, she's never going to get better. She's just going to become more and more reliant on the pills and the dialysis and the other things in order to survive. And that's not going to serve her. It's going to serve to enrich the doctors and the pharmaceutical companies without really necessarily improving her quality of life. It might prolong her life, but it will definitely not improve her quality of life. Dialysis is a horrible, horrible fate. Do you have suggestions for hygiene items, what to look for, ingredients such as dish and laundry detergent and lotion? For soap, Castile or glycerin soap is really, those are the 2 types of soap that are going to be more natural, less chemically loaded. Beyond that, looking to make sure that there, with a lot of the soaps and laundry detergents contain what's known as sodium lauryl sulfate, SLS, which is basically it's a detergent emulsifier. It's very astringent and it's not good for humans. So Castile and glycerin soaps both fit that. Heart rate going up over 10 beats, resting. U8 over X. I'm not sure that I understand that question. Any recommendations for low DLCO? Looks like emphysema, but I've never smoked. If it looks like emphysema and you've never smoked in your life, you're probably in mold. If it looks like emphysema. Mold can colonize the lungs and create airway inflammation, and that's something to consider. So I would look at the potential for mold in your environment. The other thing is, if you're not gluten-free, gluten can damage the lungs, and in a similar type of way. I've seen a number of people with chronic obstructive pulmonary disease where going gluten-free improved their ability to breathe. So, I would look there. I'd look at those 2 things as potential possibilities. Let's see. Took your genetic test for gluten. Thanks. I cut it out. Fantastic. Just wondering if feeling sleepy after meals is always damaging to the brain or not normal. Actually, it's a great question. You should feel sleepy after a meal. What happens when you eat? Your blood is redirected to your gut. Why? Because you need a lot of blood and oxygen to help digest the food that you just consumed. And so your brain, and thinking and taking massive action, is not the priority. Digestion becomes the priority. So you really, it's very common to get snoozy after a meal, especially a bigger meal. I mean, watch the animal kingdom. Anytime you see an animal eat a big meal, what do? The very first thing they do is lay down and they digest it. They lay down and rest, right? We look at the cult, like the Mexican culture. What do? They take a siesta after a meal. If you've ever been in Europe, many people take naps after lunch. Short naps, not 3-hour naps, but 20, 30-minute naps to help them relax and digest. I think in the US, we're particularly guilty of eating on the run. And so as we're trying to run, we just told our brain it didn't need the blood flow, that our gut needed the blood, and we're still trying to use our brain because we're still trying to work. And so, that's part of what drives anxiety is eating on the run, is that you basically, you make your brain and your gut play a tug of war match for the blood supply and the oxygen supply, and that's not a good thing. Does lack of B6 drive low melatonin? It can. You do need vitamin B6 to produce melatonin. You need zinc and magnesium and B6 and vitamin B2 and vitamin C and sunshine to make melatonin. So definitely B6 is one that can contribute to lower melatonin. Does verapamil deplete vitamins and any long-term damage from it possible? Lots of potential possible side effects from verapamil, but it can deplete CoQ10 and zinc, so that if you're on that medicine, those are two supplements you might consider using prophylactically. Let's see here. Penny, hi, Dr. Osborne. I have a hard time dealing with the hot weather. Any tips to combat this? Is menopause a cause? The heat triggers a migraine. Yeah, so one thing you can do, they make clothing now that has almost like a cool pack that can wrap around the neck and keep you cool. If you keep your head and your neck cool in the hot weather, it will reduce the potential for that heat trigger. They also make little fans that you can put around your neck, and they have little motors in them, and they'll drive, airflow across your head, keeping your head much cooler. So those are all things that you could potentially do outside of trying to avoid the direct, brutal aspect of the day, right? So when you go outside, in the morning, more when it's a little bit cooler, or in the evening as it starts to cool off. And you can still get your outdoor time that way. So question, all 4 markers on DNA test are positive for gluten sensitivity. Is that different than leaky gut? Yeah, because having the markers genetically for gluten doesn't mean that you have leaky gut. What it means is if you eat gluten, you'll develop leaky gut, right? So the markers don't mean genetic. That's why you probably heard me say this, gluten sensitivity is not a disease. It's genetic. And if you have the genetics of gluten sensitivity, then by eating gluten, you activate those genes to produce an inflammatory cascade, and part of that cascade leads to leaky gut. So just having the markers but not eating gluten and grains, the markers won't be, you won't be activated, so to speak. You won't create the inflammatory cascade as a result of the gluten. So not the same thing, being gluten sensitive and having leaky gut. Could iron deficiency be linked with thyroid autoimmune antibodies? You need iron to convert T4 to T3, Silvio. But iron deficiency is not necessarily going to cause thyroid autoimmune antibodies. Now, what iron deficiency tells us, so understand that gluten is, scientifically speaking, gluten is the #1 most well-studied cause of autoimmune disease, and that includes Hashimoto's. And the #1 deficiency linked to gluten sensitivity is iron. So many people with iron deficiency have iron deficiency because gluten has damaged their ability to absorb iron, and therefore the consequences of iron deficiency start to set in. And that consequence for your thyroid would be poor conversion of T4 to T3. But gluten can also be a driver of autoimmune thyroid disease. So there's a connection, but it's an indirect connection, not a direct one. How can I help my kids get enough calcium on a grain-free, dairy-free diet? That's a great question. There's a lot of vegetables with calcium. So if they're getting vegetables like broccoli and spinach, those are, although they're not animal source of calcium, they are good. There's also organ meat. Organ meat's a good source of calcium. Now, bone. A lot of us don't eat the bone, but really cook the bone down. Cook it down till it's soft and turns into a nice, thick, dense broth, and you can give that to your kids. And so that's a good source of calcium as well. Nuts contain calcium. So, you've got plenty of other options. Brussels sprouts contain calcium. If we can, let's put a link up to our calcium crash course for Aisha and go back and watch that. And there's some more information in that crash course for you. What are your thoughts on using a microwave, thinking of the scares when they first came out? I'm not a big fan of the microwave. I don't think that using a microwave here or there is going to wreck your health, but what microwaves do is they destroy the nutritional content of the food you're trying to eat. So it's just not a good idea to heat your food up with a microwave, every day on a daily basis. The way I heat my food up, and some people buy like a little oven, that heats up a little faster than turning the big oven on in the house. But, I heat my food up in a very unconventional way. So generally my food, I don't have it, if I had my lunch, I'd show it to you, but usually my food is in a glass, like a glass Tupperware, or it's in like a mason jar, which is made of glass, right? And so what I do is I set it down, and I have a floor space heater, a ceramic space heater. And so when I get into my office in the morning, before I start seeing folks, I put my food down, I have a little pedestal for it, and I have a floor heater right there that just drives warm air around the glass of the stored food. And so that glass heats up, and then subsequently that basically heats up my food inside. So that way I get a nice slow even heat that's going in, and then an hour later after I have heated my food up, I can eat it. And so that's kind of the way I do it without a microwave. That's, like I said, it's a pretty unconventional way to do it, but it's convenient for me because I have a floor space heater in my office. Some of you might be saying, turn on a space heater, I would get hot and sweaty. Well, that wouldn't be a good option for you. Another option would be to buy you they make these bags that you can buy and plug them in, and they heat up. So they heat up, and you put your food down in that, and it heats your food in it as you keep your food in it. Let's see, alpha-trypsin deficiency, also cause of emphysema. Have they been genetically? Okay, so that's somebody commenting. I was exposed to mold years ago. Could the damage be permanent? Any way to reverse it? So my experience with mold is the damage is typically not permanent. It's not to say it couldn't be. I said typically not. Number one rule of mold is get out of the mold. The longer you're in it, the more the potential for the damage to become permanent. So if you're in mold, for example, for 10 years versus 1 year, that 10 years is going to have a much more prolific effect in terms of poisoning your nervous system, because that's generally, mold's a neurotoxin and really affects the brain and the eyes. That's in a very, very big way. But it may not be permanent. I get this all the time. Mold is such a, let's just put it like this. So many people claim to be mold experts and they're not. And probably the ones that claim to have any level of expertise the most, I'm not talking about doctors even so much as I'm talking about mold inspectors. Most mold inspectors took a week in class to get their inspector certification, and they know nothing about mold. They haven't lived it, they haven't experienced it, they don't know anything medically about it or whether or not it's a potential problem. They just kind of test your air and then tell you you're crazy when you think mold may be having something to do with your health. So one of the biggest problems just comes from the industry itself. The industry is let's just say they're underqualified to be able to really do what they do. And so a lot of people get misdirected, misguided, and it creates a lot of problems. Mold is no joke. Mold is super serious. And if you suspect mold, what I see a lot is people move from a moldy environment, like an apartment, into another place that doesn't have obvious mold, but still has mold. So they're still being mold poisoned as time goes on because they don't have any understanding of how to validate whether or not mold is playing a role in their issue. Then they miss it completely. And most doctors aren't trained in it either. I mean, they completely miss it. There are very objective ways to go about identifying whether or not mold is playing a role in your inflammatory problem. And my advice, if you suspect that you're in mold, this is not a do-it-yourself project. Don't go to Home Depot or Lowe's and buy little mold plates and try to become a mold expert and figure out whether you got a mold problem. Because I can promise you, if you have got it and you don't find it with these DIY kits, you can die. Mold can kill you. Mold can colonize your lungs. Mold can damage your brain extensively. I mean, there are cases I've seen where people had full-blown dementia as a result of mold exposure. I've seen cases of even my wife, when we were in mold, she was probably a year away from full-blown dementia. I was finishing her sentences. I mean, my dog died. My other dog almost died just from the mold. So mold, you don't want to mess around with it. Is bruising easily always a sign of low vitamin C? So Vitamin C deficiency can cause easy bruising, but it's not the only deficiency that can cause easy bruising. Iron deficiency, copper deficiency, B vitamin deficiency, zinc deficiency, those can all cause easy bruising. So you don't want to get into the trap of thinking just because you bruise easy that it's just vitamin C. And then there are medicines that can cause easy bruising, like your anticoagulants, your drugs like warfarin and other blood thinners definitely cause easy bruising and pulling of blood under the skin. So it's not just as simple as vitamin C deficiency, although definitely vitamin C can cause it. Can anything be done for latex fruit allergy? Latex fruit allergy, in my experience, is oftentimes associated with mold. Latex fruit allergy, oxalate sensitivity, histamine, all three of those very commonly relate to a person who's got environmental mold exposure in a big way. So once you deal with that, then a lot of times the food allergies and sensitivities go away. So that would be what I would suggest you look into. What can help with nystagmus? For those of you who don't know what nystagmus is, it's a movement of the eyes that can create a lot of dizziness. So usually it's a lateral movement, left or right of the eyes. So the eyes will glitch back and forth like this, and that can create dizziness and trouble for a person to be able to function. One of the big causes of nystagmus nutritionally is B vitamin deficiency, particularly folate and vitamin B12. Gluten can cause it, and so if you're not gluten-free, you should potentially maybe think about getting tested to see whether or not you should go gluten-free. We could put a link of testing up for you if you'd like. That's genetic gluten testing. And then you can have damage to your inner ear canals, which can cause nystagmus. So if you haven't been to a good doctor, neurologist, ENT, or even a good chiropractor who understands nystagmus well, those would be 3 different health professionals that you could visit to get a better degree of diagnosis on that problem. Why do people react in irritability to dyes, MSG, and additives? Because they behave like stimulants. They actually bind to neurological receptors in the brain, creating a stimulus-like effect, and so that creates an irritation and irritability in the person symptomatically. Besides magnesium, what can protect you from occasional accidental reaction or ingestion, rather? If you're talking about food dyes and preservatives, don't eat out. Honestly, I mean, if you want to protect yourself, don't eat out. Carry your food with you. When you travel, carry a food suitcase, or travel somewhere where you have access to organic food. When I travel, I always make sure wherever I stay, I have a kitchen that I can to either take my own food or go to the grocery store when I get where I'm going and buy my own food, so that I don't have to worry about the swill that is served at most restaurants. I mean, I wouldn't even classify most of the food in restaurants as food. How to test for food allergies if IgG gives. So Silvio, that's a great question. We're actually, I keep saying this. I know a lot of you have been waiting because we've announced it. We're working on it right now. We're almost done. We're maybe a few weeks away, where you'll be able to test for delayed food sensitivities, not using IgG because it's a very inaccurate way to test, direct online. So we're working on it. It's just we're working out some of the details because it's very advanced testing, and we want to make sure we get it right and minimize any mistakes. Air fryers instead of a microwave. That was a comment. Somebody said air fryers instead of a microwave. The only thing I would say about air fryers is that just because they don't fry your food doesn't mean they don't turn carbohydrates into acrylamide. That high heat like that in an air fryer will convert carbs into a carcinogenic compound called acrylamide. So you can use them, but I would just say use them with caution. You don't want to have French, air fried, potatoes every night, for French fries, like a substitute, because there's still a problem with air fryers. You can use them on occasion, but kind of like a microwave. You could use it on occasion. It's not the end of the world, but I wouldn't make it something you would use as a staple in your eating or diet. I have rheumatoid arthritis and over the years it's damaged my joints. I have stopped taking treatments, and the rheumatology team have warned me that not being on medication will cause further, not sure I see the, further damage and eventually will disable me. What do you think? That's, of course, that's what they're going to say, BF. It's because it's all they know. When I was going through grad school, in my training, I trained in the rheumatology department at the VA hospital in Houston, and that was the hook, line, and sinker. If you don't take the drugs, you're going to have irreparable damage to your joints, and you're going to become crippled. Here's what I saw in my training is the people that were on the drugs for 10, 15, 20 years were still crippled. So the outcomes weren't really better. Drugs, the best they can really have to offer is pain relief and improvement of quality of life for people that are going through intense, excruciating pain. But they don't work better than diet change. I mean, my experience, especially in rheumatoid arthritis and ankylosing spondylitis, psoriatic arthritis, any of these neuromusculoskeletal autoimmune conditions respond extremely well to gluten-free, grain-free diet change and nutrition. And so if you haven't introduced yourself to that, then you need to. I'd highly encourage you. As a matter of fact, I wrote a book on the topic. PBS did a special on the book. If you didn't watch or didn't see the PBS special, it aired in millions of homes nationwide, but it's called No Grain, No Pain. We'll put a link up to you. If you buy it online, it's like an $8 book. If you go to the library, you can check it out for free. Follow the program in the book. That goes for any of you with autoimmune arthritis or any autoimmune disease for that matter. Start there. If you start there, a lot of times what people, when they come to me in my practice, a lot of them have already started No Grain, No Pain. And so they're coming in, maybe 6 months being on the No Grain, No Pain plan, and they're like 60, 70% better. And so now we're just doing mop-up. We're just getting much more specific about, testing and nutritional deficiencies and other lifestyle changes that they need to make specific for them as a unique individual. And it's a lot easier work. But imagine a book or a program allowing you to get 50, 60% improvement without even having to visit your doctor. That's pretty common. Now, I know legally I'm supposed to say these results aren't typical, everybody's individualistic, but that's my experience, and I'm going to share my experience. The people that come in, usually they're already vastly improved over where they were if they followed No Grain, No Pain, and they were struggling with autoimmune problems. Let's see, how can we help floaters? Floaters generally are glycation end products of protein folding that manifest in your visual fields. And so one of the most common causes of floaters is blood sugar that's not well controlled. So that would be the number one thing I would suggest is, know how to control your blood sugar from being too high. We get a lot of folks that are, diabetic and they, eye disease and floaters are a major, major problem in diabetics. And when they start getting their blood sugar under better control through diet change, a lot of people report floaters diminish and start to improve. So I would start there. Can you do a crash course on boron? I can, and I think it's on our list. For the year. It's on our list. We've got a number of crash courses coming up, so thanks for the suggestion. Let's see. Somebody said I missed a B1 question. I didn't see a vitamin B1 question, so if I missed it, I didn't see it. I'm super sensitive to legumes prior going grain-free, causes severe inflammation. Since I've gone grain gluten-free, can this be reversed? I believe it was caused by grain. Yeah, a lot of times, Aaron, it can be. So a lot of people, in No Grain, No Pain, one of the things I have people do is avoid legumes for at least 6 months because of their lectins and other proteins. And so when somebody's been eating gluten, there's holes ripped in their gut. And so these lectins can really cross through and create a lot of problems for those individuals. But once we get beyond that, a lot of people are able to add lectins back in, or not lectins, but legumes back in to their diet and tolerate them just fine. I've seen in children, I've watched, it takes 10 minutes before they go nuts after ingesting All the crappy substances, wheat dyes and chemicals. Yep. You just got to watch them. It's like a drug. Boom. Behavior change. I think there's a question, does bile play a large role in the solubility and disposal of cholesterol? Yeah, bile plays a role in the reabsorption and the recycling of cholesterol. It absolutely does. Are heel cracks, dry heels, as well as dry nail cuticles signs of low? I don't know what you mean by, are you talking about BS? So not BS is in the cow manure, but okay, I assume you mean B vitamins, Bs, low Bs. Can be. Heel cracks, vitamin B2, vitamin B3, vitamin B5 deficiency can be linked to those. Dry cuticles, dry nails, B vitamins, but specifically for that, biotin, which is vitamin B7, sometimes referred to as vitamin B8 as well. Can I buy products from Gluten-Free Society if I'm from Europe? You can. It's costly for the shipping. You can contact our customer service department, and that would be reaching out to Jessica at glutenfreesociety.org. A crash course in osteonecrosis. We could do one. It definitely has some major causes. Probably one of the biggest causes of osteonecrosis is steroid use, secondary to bone building drugs. The bone building drugs very much, for osteoporosis, a lot of those will cause osteonecrosis of the jaws, which is a very, very bad situation. What's the best thing we can do now to prevent or slow Alzheimer's? Eat well, exercise, mitigate your stress, get plenty of sunshine, go to bed on time, avoid drugs and alcohol, and find peace, happiness, and purpose in life. Those are the things that you can do right now. What do you think about high-dose B1 for therapeutic effects of long-term stress or chronic pain in sympathetic dominant state? Been listening to Dr. Lonsdale, and I wonder what's your take on this. So I think if you're going to use high-dose vitamin B1 for therapeutic effects of long-term stress and pain and sympathetic dominance, you can do that. B1 is pretty benign in terms of any kind of long-term side effects or health risks of overdose or toxicity. That being said, it's not a solution. Vitamin B1, using high doses of it therapeutically to create a chemical change in your body to override those problems, is not a solution. It's a Band-Aid. Just like taking pain medicine for pain would be a Band-Aid. You want to find out why you have those issues. It always boils back down to why, not what can you do to mitigate your symptoms, but why the symptoms came on in the first place. Now, again, you can use the B1, and if it gives you an improvement in your quality of life, I'm all for that. But if you don't figure out the why aspect, then you're going to struggle the rest of your life, and ultimately the vitamin B1 will become less and less effective as time goes on. Endometriosis, any advice on endometriosis and infertility? We have a pretty nice diagram on infertility and nutrition. Maybe we can pop that up in the feed and share that with you. Okay, let's see here. Are we on the right there, Mel? Are those questions from?
Yeah, that's for today.
Let's go through a few of those. Dr. Osborne, I was wondering if you can use warrior bread and make fried dough. I'm not sure I understand what you mean by fried dough. It looks like, maybe re-ask that question in a different way. I don't know what fried dough is, and I mean, unless you're talking about like frying up the dough in like a hot oil or something, if that's what you're referring to. But I've never tried it. I don't think we've ever tried to make like donuts per se and with warrior bread. Maybe we'll have our chef maybe give that an attempt and see if we can come up with something. The mycotoxin test shows citrulline level of 146. Have been suffering with clogged ear sinuses since the vid in November of 21. Are the clogged ears related to this? They could be. If you have high citrulline, one, I can tell you if you have high citrulline, I know exactly what lab you use to measure it, and I can just say this, that lab, I'm not going to say that you don't have high citrulline, but we have tested that lab numerous times and we do not get consistency in its results. So it's not a lab that I typically recommend to help people who think they may be being exposed to mold. That being said, can mold cause that clogged ear sensation of feeling? Absolutely. It can, because mold can cause excessive mucus production and fluid production, and that can build up in the ears, which can reduce the sound transmission through the tympanic membrane. Let's see, Leah, any thoughts on consistent high cortisol, high triglycerides, high cholesterol, thyroid, and good A1C and fasting glucose in functional range, yet presenting low blood pressure POTS? Yeah, you got other problems. And they're not blood sugar related. If your cortisol is chronically high, there's something driving it up. There are a lot of things that can drive up cortisol, but probably one of the biggest is any form of stress, right? Whether it be physical, emotional, or whether it be biochemical. So what is physical stress? I think we all could kind of see what that would be, right? Emotional stress, we kind of all have an idea of that. But what's biochemical stress? It's vitamin and mineral deficiencies. It's microbial imbalance. It's eating foods that you're reactive to, and they're just driving up cortisol as an inflammatory protectant. So you have to measure those things. Those things have to be measured so you understand why the cortisol is going up. Cortisol is not going up because of your POTS diagnosis. POTS is just reacting because your cortisol is always up, and cortisol being elevated causes blood sugar swings in a very, very big way, which can exacerbate the blood pressure issues associated with POTS. Same thing with high triglycerides. Remember, when your cortisol is high, it causes your liver to dump excessive glucose into your bloodstream, and if you have too much, one of the ways we control blood sugar, and again, your blood sugar looks like it's controlled. If that's the case, one of the ways we do that is the liver converts excessive glucose into triglycerides, and so you might see your sugars being converted into triglycerides in an attempt to basically manage the sugar from being too high. And so you've got to figure out what is driving that biochemical stress. That, again, with the limited knowledge you gave me, that's what I would come up with. Jessica says, you carry two types of B12. What's the difference? One of them is methylcobalamin. Methylcobalamin is the active form of vitamin B12. So when you eat vitamin B12 from food, the predominant type of B12 found in food is called hydroxycobalamin. But when you eat it, your body then has to subsequently convert it or methylate it into methylcobalamin so that it can be used by your cells. So methylcobalamin is the active form of B12, and if we're trying to really therapeutically elevate somebody's B12 levels, it's one of my favorite to use. Now, where would we use hydroxycobalamin? We would use hydroxycobalamin in somebody who has an overreaction to supplements. Generally speaking, they overreact when they take supplements. They feel bad. They feel worse. They have aggressive symptoms when they're trying to take supplements. Hydroxy is more favorable. One of the things that methylcobalamin does is it drives detoxification. This is why this happens, is when you drive detoxification, if a person is still in an environment where they're taking on toxins at high levels, then methylcobalamin can actually exacerbate them because we're mobilizing toxins to try to get rid of them, whereas hydroxycobalamin doesn't tend to have that effect. So kind of a common example of that would be somebody in a moldy environment who's being exposed to mold. Hydroxycobalamin would be a better solution for that individual, possibly, than methylcobalamin. Hello from Portland, Texas. I have Hashimoto'S and my dentist, Dr. Duncan, recommended that I check out your page. Oh, no question, just a comment. Thanks, Brittany. Tell Dr. Duncan hello for me. Wish you could help me right now. My doctor's retired a few weeks ago. I was in process of ending Levoxyl after 25 years. It just started to give me celiac symptoms. My brand new doctor offered to start me on NP Thyroid. I was on Levoxyl, and he started me on NP. After 2 weeks, I was in full-blown Hashimoto'S. Doctor asked me to come in at the 4-week mark. Feel like I will die before that. Do you know how much he should have started me on, in your opinion? I trust you, Dr. Osborne. So No, I mean, it's different for different people. I wish I could give you an exact answer, but one of the things that I would encourage you to do before your appointment, if your appointment's 2 weeks or 4 weeks away, is call that doctor back and ask them to go ahead and run your blood tests right now. And that way, as you get your blood tests, you're not waiting 4 weeks to go to the office, then get a blood test done, then wait another week or two before your blood test comes back, where you can have some kind of an answer. But get the testing done now so that when you go in there, you'll have a better answer. Let's see here. And on that note, I think they were wondering if we do phone consults. We do phone consults. If you want to call my office, you certainly are welcome to do that. 281-240-2229. We can put that in the feed for you if you'd like. Let's see here. What kind of supplement should you be taking for sleep? I'm trying to get off Ambien for years now. I'm getting 4 to 5 hours of sleep, just not enough. I have a formula, Linda, called Sleep Well, and it's got a mixture of different things in it. You know, GABA, theanine, 5-HTP, B vitamins, all very effective at helping support sleep. So you might check that out and see if it's helpful for you. As a matter of fact, I think we have this week we have a promo code for that. So if you check it out, we'll put a link up for you. It's called Sleep Well rather, and if you use promo code RELAX, RELAX, I think it saves you $10 on a bottle. If you want to check that out. You can also, you know, if it's really bad, you can also try melatonin, which we also carry. But again, I like Sleep Well first. Melatonin will be my backup plan. Let's see, I had back surgery and I'm doing no grains. It helped my digesting, but nothing for back pain. Medical surgeons are liars. Yeah. Surgery is always a last-ditch effort, in my opinion, and oftentimes it's given as the first recommendation instead of the last recommendation. I used to run a rehab clinic. I did for a number of years. That's all we did was rehab and rehabilitation, pre and post surgery. And yeah, I agree with you, Anthony. The back surgeons were always, in my opinion, too aggressive. Not with everybody, and not all surgeons, but a lot of them were just too aggressive, wanting to do the surgery as the first line of therapy instead of other things. You know, a lot of that's going to depend. So if you've had back surgery, it depends on what the surgery was for. It depends on the nature and the invasiveness of the surgery. So there are different types of back surgeries. Some of them are more invasive, some of them less so. Like a microdiscectomy is not so bad, but a lumbar ectomy can be super invasive, and they're using hammers and chisels in your spine. And so that, you know, healing from that requires the right nutrition and the right rest. And, you know, your pain may be merited because they cut you open and your body's trying to heal all that damage. That's, you know, what surgery is, in essence, is scheduled trauma. You're scheduling, you know, surgically induced trauma in an attempt to try to remove a part or fix a part. You know, so again, that trauma is still trauma. And, you know, one of the things that I would recommend if you're struggling, you're on a no-grain diet, one is get with a good functional practitioner, period. If you want to figure out whether this has got something to do with your diet or with nutrition, you've got to have the right testing done. Number two, what we do for a lot of folks that are post-surgical is we put them on glutamine, vitamin C, branched chain amino acids as a start, because those things are required in much higher quantities to recover from the trauma of the surgery. So like if we're looking at glutamine, you know, kind of think of the quantity of glutamine is about 2 grams of glutamine, 5 grams of vitamin C, and about 6 grams of branched chain amino acids, which is you know, a good place to start if you're just trying to support your recovery. And so you can find those things on Gluten-Free Society. We have something called BCAAs or BCAA. We have L-glutamine and we have Detox C. Those are all available, and you can do those things, and they may help. Let's go down. Oh wait, did I miss one? How can I follow no grain, no pain if I'm vegan? I do eat some eggs, but no other animal products or byproducts. We have a number of vegan and vegetarian recipes on Gluten-Free Society that you might want to just check out. And many of them are no grain, no pain approved. So it's still possible to follow No Grain, No Pain if you are trying to follow a plant-based diet, and that plant-based diet works best for you. Let's go down a little bit. Oh, go up just a hair. I like that comment. Terry says, love the space heater. I used to do that at work. People thought it was crazy. Yeah, people in my office think I'm crazy too. So it's good to know I have some other like-minded person out there using a floor heater, space heater to heat their lunch. Doris, will you recommend someone to test a house for mold? Are there yeah, I will. But I will say it with this disclaimer, Doris. In the industry of mold, there's a term. It's called mold gold, and the reason why is because there's a lot of crooks out there. So when I make this recommendation, I want to be very, very clear to all of you. I don't get kickbacks. I don't make money. I don't have an arrangement with this company. As a matter of fact, I actually donate to this company's nonprofit because I believe so much in the work that they do and the integrity that this company has as they go in to do mold inspections. And the other reason I recommend this company is because the owners have been through toxic mold and they know exactly the pain and the loss and the illness that's associated with it. So they will never minimize what needs to happen should you have mold. And they actually, depending on where you're at, they travel all over the country. We use them here in Texas. The name of the company is Texas Mold Inspectors. Very easy to find, texasmoldinspectors.com. And you want to ask for Emily. Just ask for Emily, talk with her, and she'll navigate you and help you out and get you squared away in that arena. Lauren's asking, can you comment on gluten, wheat, and coffee? For example, Mount Hagen Organic Instant Coffee. We contact the manufacturer and they indicate their coffee is not processed or have gluten in it. However, we are still testing positive for gluten exposure. Could it be the coffee? You know, if they're telling you they're testing, then the next step would be, to not take their word for it. It would be to actually ask them for the testing that they performed. Like usually there's a sheet where when they test their raw product and their final product, they can give you what's called the tech sheet, which is where they did, usually it's ELISA testing, enzyme-linked and immunosorbency assay testing to determine the presence of gluten. So, if they have that testing there, then I would believe it. If they don't have that testing, I might suspect it. The other thing I might ask them is, are they processing their coffee in a facility that also processes other things? Because the fact of the matter is, food recalls happen all the time where wheat is accidentally found in a product and they have to do a food recall. And so for every recall we have for gluten-contaminated food, how many do we not have because nobody found it? Because it was never really identified, and that's kind of a scary thought, right? But that's the question I would ask them. Susanna wants to know, is rice gluten-free? Technically, no. According to the USDA, or not USDA, but the FDA and the CDC, it is considered gluten-free, but technically rice is not gluten-free. Let's put up a link to, this is in our Facebook feed, let's put up a link to our article on rice for Susanna so she can learn more about why. What do you do if they want to do surgery for cataracts? Are there other options? Nutrition first. I would just say, look, if you're going to lose your sight and surgery might help you in that regard, it's not a bad trade, provided the risks of surgery aren't greater than the potential benefit. But if you haven't changed your diet and you don't have your diet dialed in really tightly, then do that first. Because a lot of times, and I've seen this be the case, where people were told they needed a cataract surgery, they change their diet and their vision improves and their eyes improve. So it's definitely something that you can do before a surgery if you're, wanting to be cautious about just having a surgery. How can I add back the nutrients removed by whole house reverse osmosis? You're talking about the minerals in the water, Peggy. Put a link up for Peggy to ultra electrolytes. And that's how, Peggy, you add a half a teaspoon for every 20 ounces of water that you consume. You don't need to add it back for your bathtub, but just add it into what you're drinking out of RO. Does high calcium in blood mean bone loss? No, it doesn't mean bone loss at all. Now, it could mean bone loss. It could also mean vitamin D deficiency. I would start there, Chris. I would start with asking your doctor. There's a test called 25-OHD, and ask your doctor to run it. If that test is less than 30, then you got a major problem. If that test is less than 50, I would suggest you supplement vitamin D to get that level up to about 70, between 70 and 100. And then, monitor the calcium and see what happens to it. The other thing is just follow up with an endocrinologist and they can figure out why that calcium is high. But a lot of times in my experience, calcium is high because of vitamin D deficiency. When your vitamin D is low, you can't absorb calcium from your diet. And so what happens is your parathyroid gland turns on and it starts pulling calcium from the bone to add to the bloodstream, because your bloodstream needs calcium, and if you go too low in your bloodstream from a calcium perspective, you can die. It can cause a heart attack. So your body's pretty good about not letting calcium drop too low in the blood. Sue wants to know, is zeolite pure good? Do I need to add charcoal? I don't know if when you say zeolite pure, you're referring to a particular product, or you're just talking about pure zeolite as a supplement. So I have something called mycobinder that you might be interested in. If we'll put a link up to mycobinder for Sue. It's got charcoal, it's got zeolite, and our zeolite is absolutely pure. It's been tested for metal contamination. And it also has fulvic acid, because when you use binder agents like that, you can bind onto some of the minerals and you can pull those out. So we add fulvic acid to it as a source of minerals so you don't cause a mineral deficiency as you're using those binders. Can a person be allergic to vitamin C? No, impossible. Is there a link between salicylate allergy and vitamin C? Not to my knowledge. It's not to say it couldn't be the case. Most people that react to salicylate, at least in my experience, are either their guts are leaking and damaged, and they've become salicylate reactive as a result of that, or they're in mold. And again, mold damages the gut as well, which is one of the reasons why it can cause a lot of different types of food sensitivity. What do I think about niacin flush? I like it. It's good. Niacin flush is basically, it's just vasodilation of the peripheral blood vessels in your skin, causing your skin to turn really, really red and get really, really hot. And for some people, it even looks like hives. Perfectly safe to do. As far as dosing, I mean, if you take a gram, I would say if you're going to take niacin to flush for any length of time, you want to ask your doctor to monitor your liver, because high-dose niacin over long periods of time can start to take an effect on your liver. And for some people, the liver enzymes go up. So again, if you're going to do that, you would want to have those monitored. Some people quit gluten more as prevention. When they start eating it again, they seem to have developed a more serious intolerance. Is it possible to build up more serious issues cutting it out? No. It's not that they've developed a more serious problem. It's that health is relative. So I get this a lot. People will cut gluten out and they'll go from being sick to being very healthy, right? And then when they re-expose themselves to gluten, because they're very healthy, their new relative state of feeling is here versus here. And so when they get that gluten in, they go back down here, right? And it's a much bigger jump from here to here than it is from just being here all the time and feeling not great all the time. So it's not really that they're reacting to it more violently. It's that they were so much more healthy that they fell backward to such a great degree that relative to where their health is now, they feel more symptomatic than they used to. How do you naturally heal gastritis or stomach ulcers? You got to find out what's causing it. I mean, there's a number of different factors involved with gastritis and ulceration in the stomach. Probably one of the most well known as a bacterial infection in the stomach called Helicobacter pylori or H. pylori, ask your doctor to measure it and see if you have that as an issue. If you don't, then you have to look at food. Most gastritis, remember, there's 3 big things that can cause damage to your stomach and intestines. One is bacterial imbalance or yeast imbalance. So basically microbial imbalance. Number 2 are chemicals that you're being exposed to that your body is trying to reject. And number 3, it's food that your body finds as irritant. So you have to look at those things and ideally measure them, because if you measure them and you know what's triggering it, you can get those things out of your diet and out of your mouth, right? And you can quit doing the damage. Now you can do things to kind of coat and line the gut to reduce symptoms, but that isn't a solution. So for example, we have a formula called GI Soothe. We'll put a link of that up for you, Savita. And all that is it's a mucilaginous product that kind of coats and lines the stomach and intestines, but it's not a long-term solution, and it's not something that you should just do forever. If it works well for you, you should still be trying to figure out why the gastritis developed in the first place. My vitamin D was 67. Is that too high? No. Vitamin D anywhere between 50 and 100 is a pretty good level. If you've got an autoimmune disease, I like to see it between 70 and 100 if you're an autoimmune case. Causes of low T3 when the T4 is normal. Probably the biggest one is selenium deficiency, iron deficiency, vitamin B2 deficiency can also do it. Those are probably the 3 top. Is there a link between gluten intolerance and pancreatic cancer? Absolutely yes. This is on YouTube if you put the link in. We have an article, Laurel, on gluten and cancer, pancreatic cancer being one of the types of cancer we know gluten can contribute and cause. We're going to put that up for you so you get more information. What can I do for Raynaud's? You got to change your diet. Raynaud's is an autoimmune condition, and if you haven't looked at the 4 triggers for autoimmune disease, you're never going to get rid of it. Is breast tomography better than a mammogram? Yeah, I mean, look, a mammogram, well, I could do a whole show on mammograms, Mandy. It might not be a bad idea to do that. Let's put that on our hopper for a future show, because I don't think I have time to answer that today. But as a general rule of thumb, this is my opinion, mammograms are overrated in their ability to help somebody understand what to do. Most of them are, it's like fear porn. Mammograms. Anyway, I'm not going to dive into that because I think it deserves more time. Let's see here. Do you have an omega-3 supplement that's good for vegans? If you're talking about vegans where you don't eat any fish at all, no. And the reason why is that vegan-based omega-3 is ineffective at bringing up omega-3 levels in the blood, especially EPA, Desiree. Look, I've been doing this 21 years, and I have yet to see a vegan vegan omega-3 supplement properly get a person's omega-3 percentages in their blood cells up to where it should be. I mean, usually with vegan, vegan supplements have 0 effect. So like if you're trying to use flaxseed oil, for example, or chia seed, because those have, really technically they don't have omega-3, they have pre-omega-3, and the body has to convert those into omega-3. So this is one area where, some people choose a vegan lifestyle where they want to eat no animal-based products at all. I'm not going to argue with you over the merits of that. If that's your belief and that's what your conscience is telling you to do. But I'm just going to share that my experience is that I've never seen anybody using a plant-based omega-3 supplement ever be able to bring their omega-3 levels up to non-deficient status. And that to me says something. So it's one of those areas where if you really want to stay on a plant-based diet, taking a fish-based omega-3 is something I would highly recommend if you're trying to stay healthy. Let's see, how much calcium is needed for severe osteoporosis? It depends. I mean, you may not need any calcium for osteoporosis, right? Osteoporosis is not a disease caused by calcium deficiency. I mean, osteoporosis is a complex condition that calcium can play a role in, but calcium deficiency doesn't cause osteoporosis. If it did, everyone with osteoporosis who took calcium would end their osteoporosis, and we just don't see that happening. So as a general rule of thumb, if you want to take anywhere from 800 to 1,200 milligrams of calcium a day supplementally to support bone health, you can do that. But I think the better answer I could give you is to check your intracellular calcium levels to see if calcium is playing a role in your osteoporosis. How long does it take to detox from gluten? Man, I did a whole show on that, Pippi. We're going to put a link up for you. How long does it take for gluten to leave your system and detox? So we'll put that link up for you in the feed. My T4 is high, but T3 and TSH is normal. What should I do? I mean, that's too broad of a question. You should talk to your doctor. If your T4 is high and you're not on thyroid medication, then you should get tested. You should get some testing done to make sure that your thyroid is properly functioning. If you're on thyroid medication and your T4 is high, then you're being over-medicated, and you should talk to your doctor about that. That's a good place to start. So Wiley Cat says, I just completed 6 months of chemo. Well, sorry to hear that. You had to go through that, Wiley Cat. I know that's a rough deal. I'm glad you're in remission, but you've got a severe neuropathy in your hands and feet from it. How can you help heal the neuropathy? 3 things. I have a product called Be Complete. I have another one called methylcobalamin, and I have another one called Alpha Max. Take those 3. Take 2 each of those 3. Those will help support nerve regeneration and nerve healing. What causes tinnitus? Tinnitus for some of you. Lots of things. One of the biggest causes of it is gluten. I've seen a lot of things cause it. Other food allergies, heavy metal can cause it. What nutrients are helpful depends on the person, but as a safe rule of thumb, B vitamins are definitely necessary to help in that regard. So good quality multi-B vitamin. What could be something else that could assist? Oh wait, I missed one. Why do I bruise on my arms? Fish oil makes it worse. I avoid wheat. Are you on blood thinners? Are you on supplements that thin the blood? What are some of those? Ginkgo biloba, high dose vitamin E, high dose fish oil, high dose magnesium. These are all things that can make your blood thinner and can make you bruise a little bit more easily. So look at your supplement list, cross-reference those with things that might cause easy bruising, but then also, I see you're avoiding wheat and most dairy. Well, wheat is not gluten. Wheat is, all wheat contains gluten, but not all gluten is found in wheat. And so you might also consider that your arms are bruising easy because you're malnourished and the vasculature and the collagen around your blood vessels break open too easy. And so you might have easy bruising as a result of micronutrient deficiencies brought on by damage from food that you're eating. So test your food. Test your micronutrient status, and you'll have a good kind of place to begin making some diet and lifestyle changes. Let's go down a little bit now. Okay, too far. What could be something else that could assist me with my constipation when I have IBS and microscopic colitis, and I'm eating a great whole foods diet with a lot of fruits and veggies and no dairy or gluten products? Are you eating grain-free, Gene? Not just gluten-free, but grain-free, because that may be a big part of your problem. You also might have some food sensitivities that are damaging your GI tract. And so getting tested for those would be a great place to start. As far as assisting with constipation, if you need like immediate relief, I have a product called GI Restore, and you take 1 to 2 capsules before you go to bed at night, and that should help support a good bowel movement for you the next day. So that would be something that would help you temporarily, but I wouldn't recommend using that indefinitely forever, right? Other things people use to help with bowel movements are, higher doses of vitamin C and higher doses of magnesium. Vitamin C, 4 to 10 grams a day. Powder form is better for this. And then magnesium, anywhere from 6 to 800 milligrams a day can be helpful. Okay. All right, I think we're out of time. I think we went 15 minutes over. That's okay. Hope you guys learned something today, got something out of the show. Look, do me a favor. We need you to share this information, especially if you found it was helpful. Our goal is to save 100 million lives. Hashtag save 100 million lives. Help me reach more people. Pay it forward. Thanks for spending your Tuesday afternoon with me. Make sure you tune in next Tuesday, every Tuesday. We've changed the date, so every Tuesday for a live show where you can come and join me for more nutritional information. And then we're back here every Thursday at 12:30 Central Standard Time PM for a live Q&A. So again, thanks for tuning in. Thanks for being a part. And we will see you on Tuesday night. Take care.